Welcome back. Deadly drug overdoses are at a concerning rate in North Carolina, with nearly 4,000 deaths last year. This trend being driven by the growing number of counterfeit pills laced with fentanyl. An alarming amount of these deadly pills are being bought by teenagers and young adults on places like Snapchat, TikTok, and other social media apps. Joining us now to talk more about this is Executive Director of the Partnership for Safe Medicines, Shabir Safdar. Shabir, thanks for coming on. We appreciate it.
Thanks for having me.
All right, first talk about what is the role here specifically when it comes to social media? Why is it playing out on these platforms?
Well, social media has been somewhat terrible at actually getting crime off their platforms. So drug traffickers have moved online to get easy and cheap access to potential customers. And we've been tracking this for about the last 4 years, and we've seen that we can confirm in 19 different states, people who met their drug trafficker on social media like Snapchat and then bought fake medicine from them after the fact have died. And that 19 state estimate is probably low. We've heard from families who say their cases have not been made public yet, and that they are also involved in fatalities involving social media.
Allow me to be a little naive for a second, because it seems like buying the over-the-counter medications on social media seems at odds when you have a drugstore right down the road. How can you tell if these pills are counterfeit, or am I missing something?
Well, these pills are typically not over-the-counter pills. The pills that people buy on social media are things like Percocets and other controlled substances that require a prescription. And so you can't just walk into CVS and get them without a prescription. There's actually access issues for you.
Got it. That's what's happening. What is your message as far as for the families out there of some of these teenagers who are concerned? What is your message to parents and families?
Well, so it's really about education at the parent level. You know, we have to talk to our kids. It's what I hear from parents who've lost children to these murderous drug dealers, that they had no idea that fake pills that could kill in one dose exist. So you have to talk to your kids, as I have done to my teenagers, and explain to them that these dangers exist, that the people that maybe share them with you, their friends, don't even know that they're deadly pills, and to try and make safer choices. Ultimately, as you know, if you're a parent, you can't be with your kids 24/7. You have to arm them with enough information and hope that they make better choices. And this is really the latest incarnation of a long 20-year problem of global counterfeit criminals sending fake medicines to America. Right now, it's fake Percocets and Xanax and Adderall, but it's been fake blood thinners and cancer medication. We have to do everything possible to keep these criminals out of our drug supply and refuse to go along with proposals to import medicine from other countries where it might not be as well regulated.
And what's the role of law enforcement in all of this?
Well, we have to support law enforcement. They have more crime than they can possibly prosecute and investigate. So we have to make sure they have all the resources they need. And we have to be careful not to make the problem that they're dealing with worse by opening up access to our country and our drug supply to foreign criminal counterfeiters.
All right, listen, thanks for coming on. We do appreciate it. It's a difficult topic that we know a lot of families in North Carolina are concerned about right now. Shabir Safdar with the Partnership for Safe Medicines. Shabir, thanks.
Thank you very much.